Hello, I'd like to introduce you to the EZZI-LIFT, and I'm going to do a small demonstration for you. The EZZI-LIFT is really simple to use. It has 4 programs, 2 programs for the eyes and 2 for the face. We use eye stimulate on the eyes when we stand still, when we're actually just placed on the skin, and eye smooth when we're moving the device, and the same with the face. Normally when I start a procedure, I start right down here because I'm actually trying to give a breast lift as well as dealing with the face. But today we're just going to start here at the neckline. So I've placed my device in the stimulate for face, and I leave it on the skin for between 3 to 5 cycles. After those cycles, I move it about 1 inch across and do another 3 to 5 cycles. Then I go up underneath the chin, and then once I've done that, I'll turn it into the smooth, and then I will actually put a fair amount of pressure on, and I will smooth upwards. When I've completed about 10 of these programs, I'll then move to another part of the face. I tend to work upwards all the time, so now I'm just going to place it here. Now remember that your device is in the stimulate mode because you're actually holding it still for the 3 to 5 cycles. Then you change it back into the smooth, and you smooth upwards. Then when you get to the eye area, you're going to change it into the eye mode, and you want to go to eye stimulate. You have many more wrinkles around the eyes, and it's usually one of the first places that it's usually when we age the area that we start to notice the most and want to work on the most. Remember, when you're setting your power, you always set it to the individual themselves. And if they say during the procedure that, okay, it's getting a bit strong, just turn it down. And if they say they can't feel it, obviously turn it up. Once I have done those, with the eye, I tend to work around the eye like this. And there are a couple of attachments that work very, very well with this. So on the eye, you could use this, which we call a pencil probe, or you could even use the finger probe. So once you've done that area, you need to do the forehead. So we would do, obviously, your 3 to 5 cycles up here, and then you work upwards. You can work downwards, and you can even work across. When it comes to the very fine lines on the forehead, which actually work quite strongly on these, and then I just work these out as though I'm painting them, and you'll find that within the very first treatment that you'll have a very, very big change, but within about 5 treatments, that doesn't come back. It has a holding pattern for those wrinkles on the forehead and also around the eyes. We do have 2 devices. One of them has photodynamics and the other one doesn't. They are both very, very simple to use. The one that has photodynamics looks like this. The advantages of having one with lights is the fact that you get the bonus of having the lights that can work on things like acne. Electrostimulation is very, very good in itself, but then you have the added bonus of having the lights. You can work with acne, you can work with any skin complaint. It does actually drive things in further, and so therefore it is an extra bonus.